topic for today's discussion is anatomy of the ulnar nerve and its clinical importance. And this is what we are going to study in today's session. Ulnar nerve is continuation of the medial cord of the brachial plexus. So as you can see in this picture, this is the brachial plexus and the ulnar nerve is arising from the medial cord of the brachial plexus. So it is also called as the musician's nerve as it is involved in controlling fine movements of fingers. So if you see the origin of the ulnar nerve, as I already mentioned you that it arises from the medial cord of the brachial plexus, which arises from the anterior division of the lower trunk. So we all know that the lower trunk is formed by the nerve roots C8 and T1. So the root value of the ulnar nerve is C8 and T1, right? So next is the course of the ulnar nerve. So in the axilla, because ulnar nerve is formed in the axilla, so let us begin our discussion with the axilla itself, right? So ulnar nerve originates from the medial cord of the brachial plexus to lie between the axillary artery and the axillary vein, right? So in the axilla, we have axillary artery, but the ulnar nerve is related to the third part of the axillary artery. So medially it is related to the axillary vein and laterally it is related to the axillary artery. That is the reason here I am saying that the nerve lies between the axillary artery and the axillary vein in the axilla, right? So next, after that, the nerve enters into the arm. So in the upper part of the arm, mainly the nerve is posteromedial to the brachial artery, right? In the arm, that is mainly in the upper part of the arm, it is posteromedial to the brachial artery and it runs along the medial aspect of the arm in its upper half. So here, mainly what happens is in the middle of the arm. So let me show this. So this is exactly at the middle of the arm. So exactly at this area, that is in the middle of the arm, it pierces medial intermuscular septum at the arcade of Struthers. So exactly here, the nerve pierces the medial intermuscular septum at the arcade of Struthers. So what is the arcade of Struthers here? Let me explain with this diagram. So as you can see in this picture, this is the ulnar nerve. It is piercing the medial intermuscular septum, right? So where it is piercing the medial intermuscular septum, where you can find the aponeurotic fibers. So these are the aponeurotic fibers which are connecting the medial head of the triceps and the intermuscular septum. These fibers, these aponeurotic fibers are nothing but called as arcade of Struthers. So as you can see the arcade of Struthers, and if you point, this is the medial epicondyle of the humerus. So the arcade of Struthers is approximately 8 centimeters from the medial epicondyle, right? So let me repeat again. In the middle of the arm, the ulnar nerve pierces the medial intermuscular septum at the arcade of Struthers. The arcade of Struthers is nothing but an aponeurotic band extending from the medial intermuscular septum to the medial head of the triceps, right? After that, it enters into the posterior compartment of the arm. So till upper half, it is in the anterior compartment of the arm. But after piercing the medial intermuscular septum, the nerve reaches the posterior compartment of the arm where it is medial to the triceps muscle, right? So as you can see here, it is medial to the triceps muscle and reaching the posterior compartment of the arm in its lower half. So here, that's what I told you, that it enters into the posterior compartment of the arm after piercing the intermuscular septum. It lies medial to the triceps brachii muscle in the posterior compartment of the arm. Generally, we will say that anteromedial to the triceps brachii muscle. So this is what is the course of the nerve in the arm. So here next is from the posterior compartment of the arm, the nerve reaches posterior to the medial epicondyle. As you can see in this picture also, as you know that this is the medial epicondyle. So at the posterior compartment of the arm, it is passing behind the medial epicondyle. The same course I can also show you even in this diagram, right? So the nerve is reaching the posterior compartment of the arm where it is posterior to the medial epicondyle at the elbow along with the superior ulnar collateral vessels in the cubital tunnel. So the superior ulnar collateral artery is also accompanied with the ulnar nerve at the posterior aspect of the medial epicondyle, and both the vessels enter into the cubital tunnel. So let me show you this picture. This is the cubital tunnel. As you can see, the nerve is passing through the cubital tunnel. So not only the ulnar nerve, we can also see the artery along with the nerve, that is the superior ulnar collateral artery passes beneath the cubital tunnel. So when we say cubital tunnel, how the cubital tunnel is formed and what are the boundaries, what's the roof and what's the floor. So we need to know this here. As you can see, these are the fibers which are covering the cubital tunnel as a roof. So the roof of the cubital tunnel is formed by Osborn's ligament proximally. So this is the Osborn's ligament. So proximally, or we can say roof is formed by the Osborn's ligament, and the floor is formed by the posterior and transverse bands of the medial carpal ligament. So floor, we cannot see the floor here, but the floor is formed by the posterior and transverse bands of the medial carpal ligaments and also the capsule of the elbow joint. So the roof is formed by the Osborn's ligament and the floor is formed by the posterior and transverse bands of the medial carpal ligaments and elbow joint capsule. So from here you can clearly see the nerve is passing between the two heads of flexor carpi ulnaris. So this is the flexor carpi ulnaris muscle. It has the humeral head and it has an ulnar head. So it is passing between the humeral head and the ulnar head of the flexor carpi ulnaris to reach the anterior compartment of the forearm. So listen carefully here. It enters the cubital tunnel behind the medial epicondyle. From there, the nerve passes between the two heads of flexor carpi ulnaris. The two heads are humeral head and the ulnar head, but as you can see the aponeurotic fibers which are connecting both the heads. This aponeurotic fibers are nothing but called as aponeurosis flexor pronator. So deep to the aponeurosis flexor pronator, which is connecting the humeral head and the ulnar head of the flexor carpi ulnaris, it passes deep to it to reach the anterior compartment of the forearm. This is how you will see the course of the ulnar nerve at the elbow, right? So in the forearm what happens is, as you can see in this picture, in the forearm it passes between the flexor carpi ulnaris and flexor digitorum profundus. So on the medial aspect of the forearm, it runs between the flexor carpi ulnaris muscle and the flexor digitorum profundus to reach the wrist. So this is what you need to know about the course of the ulnar nerve in the axilla, arm as well as in the forearm. Now let us see what is the course of the ulnar nerve in the hand, right? So in the hand, if you see, the ulnar nerve enters the hand by passing lateral to the pisiform bone, right? So if you see this, I will draw a pisiform bone over here. So it runs lateral to the pisiform bone now and posteromedial to the ulnar artery. It is lateral to the pisiform bone and posteromedial to the ulnar artery, and it lies superficial to the flexor retinaculum. As we studied in the median nerve, which passes deep to the flexor retinaculum, but you can see the ulnar nerve passes superficial to the flexor retinaculum, right? But it lies Not only superficial to the flexor retinaculum, it also lies superficial to the transverse carpal ligament. So there is a transverse carpal ligament and also flexor retinaculum. So above the flexor retinaculum, above the transverse carpal ligament, you can find ulnar nerve along with the ulnar artery. So here above the flexor carpal ligament and superficial to the flexor retinaculum, the nerve enters into the Guyon's canal. So what is the Guyon's canal? So here the Guyon's canal, as you can see the roof, because you cannot see all the boundaries of the Guyon's canal in this picture. The roof of the Guyon's canal is formed by the volar carpal ligament. So the roof is formed by the volar carpal ligament, and this is the floor. As I already told you that the nerve is passing superficial to the transverse carpal ligament and superficial to the flexor retinaculum. So the floor is formed by the transverse carpal ligament, flexor retinaculum and also hypothenar muscles. So the roof is formed by the volar ligament and the floor is formed by the transverse carpal ligament, flexor retinaculum, hypothenar muscles, and it has the ulnar border as well as the radial border. So this one is the ulnar border and opposite side is the radial border. So the ulnar border of the Guyon's canal is formed by the pisiform bone as well as the pisohamate ligament. Not only that, you can also find a small muscle called as abductor digiti minimi. So the ulnar border is formed by the three structures: pisiform, pisohamate ligament and the belly of abductor digiti minimi. And you have the radial border. The radial border is formed by the hook of the hamate. This is how the Guyon's canal is formed by the following boundaries. So through which the nerve enters into the hand. So this is what is the course of the ulnar nerve in the axilla, arm, forearm as well as in the hand. After entering into the hand, as you can see this, the nerve divides into two branches, right? So one is the superficial branch and another one is the deep branch. So you can see the deep branch and another one is the superficial branch. Now let us talk about the branches of the ulnar nerve in detail. First let us discuss about the branches of the ulnar nerve in the arm. So remember that ulnar nerve does not give any branches in the arm, right? So let us start our discussion with the branches in the forearm. So in the forearm, ulnar nerve gives off three branches. They are mainly the muscular branches, cutaneous branches and the articular branches. So there are totally three branches which are given in the forearm by the nerve: muscular, articular as well as cutaneous. So what are the muscular branches which are supplied by the ulnar nerve in the forearm? So it supplies flexor carpi ulnaris, because already we know that the nerve is passing between the flexor carpi ulnaris and flexor digitorum profundus. So it is giving a small branch, as you can see, to the flexor carpi ulnaris, and also it gives off, let me divide the flexor digitorum profundus into two halves. Medial half of the flexor digitorum profundus is innervated by ulnar nerve. You can see very clearly two muscular branches. The one muscular branch in the forearm is for flexor carpi ulnaris, and the second muscular branch, this is the second one, is for the medial half of the flexor digitorum profundus, because we already studied in the median nerve that the lateral half of the flexor digitorum profundus is innervated by the median nerve. So these are the two muscular branches in the forearm. Next, what are the cutaneous branches? So here the cutaneous nerves of the ulnar nerve divide into palmar and dorsal branches. So what are the palmar branches and what are the dorsal branches, we need to know here. So if you talk about the palmar branch arises at the middle of the forearm, right? So palmar branch of the ulnar nerve, that is the palmar cutaneous branch, arises in the middle of the forearm, and it mainly supplies the skin of the hypothenar eminence. So as you can see this is the palmar branch. This is the palmar branch, arises approximately at the middle of the forearm, and it also passes superficial to the volar ligament. We already studied that the volar ligament is forming the roof of the Guyon's canal. So it is passing superficial to the volar ligament, and mainly it supplies the skin of the hypothenar eminence. So this is the area of the hypothenar eminence. It mainly supplies the skin of the hypothenar eminence, right? So next is the dorsal branches. So I told you that one is the palmar branch, next are the dorsal branches. Dorsal branches are mainly arising from the distal forearm and it winds backwards, and it mainly supplies the medial toe end of fingers, as you can see in this picture. Mainly the dorsal branches arises from the distal aspect of the forearm, and it supplies medial toe end of fingers and also adjoining area of the dorsum of the hand. That is what you are seeing in this picture. So we completed the muscular branches and the cutaneous branches, and what are the articular branches at the forearm? The articular branch is very important here, articular branch to the elbow joint itself, right? So in the cubital tunnel only it is giving an articular branch. So articular branch to the elbow joint and muscular branches to the flexor carpi ulnaris and the medial half of the flexor digitorum profundus, and also it is giving the cutaneous branches what we discussed right now, right? Now let us talk about the branches in the hand. In the hand, I already told you that the ulnar nerve is giving two branches, superficial branch as well as the deep branch. So if you see the deep branch passes along the deep branch of the ulnar artery. It is predominantly a motor nerve, which means it is giving innervation to the important muscles of the hand. So let us see what are the muscular branches the deep branch is supplying. As you can see in this picture, it arches laterally across the palm to supply totally 8 interossei as well as the medial 2 lumbricals. It supplies all the dorsal as well as palmar interossei, as well as it supplies the medial 2 lumbricals. And finally, as you can see this arch, it terminates, right? So where it is terminating? At the thenar area. So it terminates by supplying adductor pollicis and occasionally flexor pollicis brevis. So it terminates by supplying the adductor pollicis and occasionally it also innervates the flexor pollicis brevis. So these are the muscular branches by the deep branch, and it also gives small articular branches to supply the wrist joint, and next is the superficial branch of the ulnar nerve in the hand. So we discussed about the deep branch. Now let us concentrate on the superficial branch. So here the superficial branch of the ulnar nerve is predominantly sensory. The deep branch is motor and the superficial branch is sensory in nature. So it gives a muscular as well as cutaneous branches. So what are the muscular branches which are given off by the superficial branch? It only supplies palmaris brevis muscle. So it only supplies one muscle. The superficial branch supplies only one muscle, which is chiefly cutaneous, but it also has some motor activity because it is supplying one muscle, that is palmaris brevis muscle. And what are the cutaneous branches? So if you see this superficial branch, it further divides into medial and lateral branches. As you can see here, it further divides into the medial as well as lateral branches, right? So this medial branch supplies the medial side of the little finger. As you can see here, the medial branch supplies the medial side of the little finger, and next is the lateral or common digital branches, right? This is the lateral, or it is also called as the common digital branches. So the lateral or common digital branches gives rise to two palmar digital branches that supply ring finger as well as the little finger, right? Adjoining sides of the ring finger as well as the little finger. So here the lateral branch of the ulnar nerve communicates with the median nerve. This is the important point what you need to remember. So what is the innervation of the ulnar nerve? So we already discussed that it has a motor innervation. In the forearm, it gives innervation to the flexor carpi ulnaris, flexor digitorum profundus, and it also gives innervation to the thenar muscles because it is arching over and supplying the thenar muscle, that is adductor pollicis and also occasionally deep head of flexor pollicis brevis, and it mainly supplies the muscles of the fingers, that is interossei. I already told you that it gives off innervation to the 8 interossei, that is dorsal and palmar interossei, and third and fourth lumbricals, hypothenar muscles, abductor digiti minimi, opponens digiti minimi, and flexor digiti minimi. These are the hypothenar muscles. And talking about the sensory innervation, the sensory branches of the ulnar nerve are of dorsal cutaneous branch, palmar cutaneous branch, and the superficial terminal branches, right? This is what you need to know about the anatomy of the ulnar nerve. Now let us talk about the clinical significance of the ulnar nerve. As I already told you in the beginning of the lecture that the ulnar nerve is also called as musician's nerve, as it is involved in fine movements of the finger. So here injury is common at the two sides along its course. One is at the elbow, that is behind the medial epicondyle, that is in the cubital tunnel, because we know that the cubital tunnel is posterior to the medial epicondyle, and the injury at the elbow is usually associated with the fractures of the medial epicondyle. And at the wrist, as we all know that the nerve passes superficial to the flexor retinaculum because of its more superficial nature. So here, because of its position, the nerve makes it vulnerable to damage from cuts, wounds, as well as the lacerations. So here, let's go into detail. What is the clinical problem and what is the clinical presentation if ulnar nerve gets injured at the elbow, and what is the motor loss over here? So we all know that if there is an injury to the ulnar nerve at the elbow, so what happens? What all the innervations, that is motor innervation of the forearm is lost, as well as the motor innervation of the hand is lost, and also there is loss of the sensory innervation too. When we talk about the motor problems, if there is an injury at the cubital tunnel, function of the flexor carpi ulnaris, because it is innervating the flexor carpi ulnaris, and also the function of flexor digitorum profundus, that is because the medial half is innervated by the ulnar nerve. So the function of flexor digitorum profundus and the function of flexor carpi ulnaris is lost. So that is the reason, because of these two muscles are paralyzed, patient will be unable to make a fist because of the synergistic action of the flexor carpi ulnaris is lost. So this is what is the problem, motor problem you will see if there is an injury of the ulnar nerve in the cubital tunnel. Not only that, you will also see flattening of the medial border of the forearm. So why there is a flattening of the medial border of the forearm? Because of the tone of the muscles are lost because of the denervation. So flattening of the medial border of the forearm owing to paralysis of ulnaris as well as the profundus muscles. Next, if we see the movements of the wrist, flexion of the wrist results in abduction of the hand mainly due to the paralysis of the flexor carpi ulnaris. Next is there will be the flexion at ring as well as little fingers are lost because of the denervation, and mainly it is giving innervation to the 8 interossei, that is dorsal as well as palmar interossei. So these are called as the small muscles of the hand. So here the small muscles of the hand will be paralyzed except the muscles of the thenar eminence, because the muscles of the thenar eminence are innervated by the median nerve, and also the first two lumbricals are also innervated by the median nerve. So there is no problem to the thenar muscles, there is no problem to the first two lumbricals because they are innervated by the median nerve. Other than that, all the interossei, that is dorsal as well as palmar interossei, and the medial lumbricals and all these intrinsic muscles of the hand, paralysis is responsible for the weakening of the movements of fingers, right? Not only that, you may also see adduction of the thumb is lost mainly due to the paralysis of the adductor pollicis, because adductor pollicis is innervated by the ulnar nerve. So these are all the motor changes we will see in the ulnar nerve injury at the elbow. And what is the sensory loss if there is an injury of the nerve at the elbow due to the cubital tunnel? So mainly the sensory loss on the palmar aspect of the medial one end of digits. As you can see in this picture, you will see sensory loss on palmar aspect of medial one end of digits is the classical feature to identify the ulnar nerve injury. Next, this is what is the clinical presentation, what you will see, injury of the nerve in the cubital tunnel. Now what happens if there is injury at the wrist? So injury of the ulnar nerve at the wrist causes ulnar claw hand. So to identify this ulnar claw hand, let us concentrate on what are the signs and characteristics of the ulnar claw hand. So mainly you will see hyperextension of metacarpophalangeal joints. As you can see in this picture very clearly, one can see the hyperextension of the metacarpophalangeal joints, flexion of the interphalangeal joints more pronounced in the ring as well as little fingers because they are innervated by the ulnar nerve, and you can also see hollowing of the intermetacarpal spaces. Along with that, inability to spread out fingers and also the problem with the flexion of ring and little fingers is lost. Not only that, you may also see adduction power of the thumb is lost. So these are all the problems which are listed out in this table are mainly the characteristic signs and features of the injury of the ulnar nerve at the wrist. Now, what are the sensory loss in the palmar aspect? Sensory loss in the palmar aspect, mainly you can see in this picture that the medial one end of digits including nail bits and also medial 1/3 of the palm sensation is lost because innervated by the ulnar nerve. So these are the muscular as well as sensory changes. Now, what are the vasomotor changes which are mainly seen if there is an injury to the ulnar nerve at the wrist? So if you see here, skin areas with the sensory loss is warm and dry, is mainly because of loss of sympathetic innervation. So there will be an arteriolar dilation and loss of sweating mainly because of loss of sympathetic supply. So these are the changes which are seen in the area supplied by the ulnar nerve. Next, what are the trophic changes? The area which is supplied by the ulnar nerve, if it gets injured, it is dry and scaly skin. One may also see atrophy of the finger's pulp and brittle nails. Mainly if there is injury at the wrist, claw hand is more pronounced in the medial fingers, mainly because of intrinsic muscle function is lost. So while the lateral 2 digits lumbricals are innervated by the median nerve. Now, what are the investigations which are performed when there is an injury of the nerve mainly at the wrist due to ulnar claw hand, right? So which causes ulnar claw hand? Investigations or nerve conduction studies are performed, and after nerve conduction studies, depending upon the severity of the injury, the treatment options are available. The treatment options are medical and surgical. So what is the medical treatment in this? If we talk about the medical treatment, analgesics are used if the nerve lesion is associated with the fracture. Otherwise, we are not using any analgesics. But mainly if the compression is more severe, if the paralysis and the motor function is lost, and if there is more damage to the nerve, then there will be an exploration and suturing of the nerve is possible, and also an anterior transposition of the ulnar nerve at the elbow joint is the surgical option, right? So this is what you need to know about the clinical anatomy of the ulnar nerve.